If you are considering knee surgery, whether it's arthroscopic knee surgery or even something bigger like a knee replacement, I want you to consider a few things first. I'm Dr. Carrie Jose. I own CJ Physical Therapy and Pilates in downtown Portsmouth. We've been talking about this all month long because it's Knee Pain Awareness Month. People have been asking me a lot of questions because, in some cases, their friends have had knee surgeries and they've done great and they're just skipping along and doing everything they want to do. But there's a lot of cases where their friends have gotten knee surgery and it hasn't gone as planned. Their knee still hurts. It's not moving like they thought it would. In fact, I talked to a woman just a couple weeks ago who literally had this happen to her. She was considering a surgery for her other knee and she really didn't want it to happen because the first one didn't go according to plan. The doctor said her knee would be moving better than it was and the pain would be gone. And it was like 12 months later and she still wasn't where she wanted to be. So you definitely want to consider all of your options before you get any kind of surgery. But today we're talking about knee surgery, okay? So there's a couple things. The number one thing, talk about this all the time, is that you must make sure you have the right diagnosis. What I mean by that is just because there's pain in your knee doesn't mean your knee is where you're having all of the problems. A lot of times their knee suffers because of a problem elsewhere. Their knee takes the brunt of a problem happening in their hip or their back or sometimes even their ankle or their foot. And if you don't get that fully looked at and addressed and you go and start doing procedures and surgeries on your knee and we don't really need them, now you've got bigger problems because that knee was already suffering from a problem elsewhere. Now you've added trauma to it, aka a surgery. Even minimally invasive surgeries, you have to go into the tissue and cause damage, right? The number one thing is to make sure that you're actually dealing with a primary knee problem. And I'll tell you what doesn't tell you that. MRIs and x-rays, images do not tell you the full story. They tell you part of the story, but they don't tell you the full story. You need to consider the whole person, the whole body, what their life looks like, all the activities they're doing. You have to kind of be a detective, a movement detective, I like to call it, to really figure out where the problem's coming from. And in our office, we check it all, okay? We check your back and your hip first to see if there's any association to the knee. And if there is, we know we have to address that first. There might still be a knee problem, but in those cases, a lot of times, the knee gets way better than the actual knee problem is so easy to fix. You never actually needed a surgery, okay? The other important thing is when we talk about arthroscopic knee surgeries, they're one of the most common surgeries performed. They're minimally invasive. The marketing of it is you're in and out, you'll be walking around, no problem. That's not always the case, okay? And the other thing is people get arthroscopic surgery for things like meniscus tears, right? They've done a lot of studies where they've done what's called a placebo surgery, which is fake surgery on people with meniscus tears, and they compared the results to groups who had actual surgery, and the groups did the same, okay? You can totally heal a meniscus tear without surgery, okay? In our office, we use something called regenerative shockwave therapy and high frequency magnetic therapy together. We call it regenerative therapy. It's like a precursor to like PRP to help people get the healing they need to their, cartilage and tissue in their knees, okay? So these things combined with the right movement can totally help you avoid a surgery. But okay, arthroscopic surgery, it's minimally invasive. Who cares? Well, the reason you want to care is because they've done, I do a lot of research, they've done other studies that show people who get arthroscopic surgery on their knee are more likely to get a knee replacement and they'll get it sooner. And ironically, people try to get these arthroscopic surgeries to avoid a major surgery down the line, okay? So there's a lot of things to consider before you actually get a knee surgery, even if it seems like it's minor. It's just, I'm in this field, right? I've been doing this for 24 years. I see the complications that just aren't talked about. And sometimes I see the complications the surgeons never see, okay? Because they happen later and the person's just not following up with the surgeon anymore. You want to just make sure you get all the information you need to make your best health decisions, and that's what I'm here for. It's why I do these videos, why I write these articles. I did write an article for you about what to consider before getting a knee surgery, so have a read if this information speaks to you or appeals to you, and please share with your friends and family. It might help them as well. Hope you guys are having a fabulous day.